Hello, connecting your call. And you are now connected. Hello?
Hi, I'm looking for Kelly.
Yes. Hi there. This is Kelly. Who's calling?
Hi, this is Janice from Dr. Vasquez's office. I wanted to take a moment to kind of walk through the surgery that you're going to be having, just to make sure you have some more information as we get closer to your surgery date.
Oh, okay. Okay. Yeah, that's totally fine. Yeah, do you mind just kind of elaborating on that?
Of course, you're going to be having what's called a bypass surgery. This is done to help blood flow better to your heart. So, right now, some of the blood vessels that bring blood to your heart are narrowed or blocked. And the surgeon is going to take healthy blood vessels from another part of your body, like either your leg or chest, and use it to create a new pathway for blood to flow around the blocked area. That's why we call it a bypass surgery. And what you can expect is before surgery, you'll get medication and anesthesia. So you'll be completely asleep. You won't feel anything. The surgeon will make an incision down your chest to reach your heart. A machine may take over your heart and lung functions during the surgery, but don't worry, this is a normal part of the process. And then the surgeon will attach a new blood vessel to go around the blockage. And once the bypass is done, they'll close everything back up. And after surgery, you'll go to the ICU where you'll spend a few days there. We'll monitor you closely as you wake up. And you'll be in the hospital for a total of 5 to 7 days, and we'll help you manage your pain and get you moving again gradually. And just to know, it's common to feel tired or sore for a few weeks. You'll have follow up visits and possibly cardiac rehab to help with recovery. And we'll be there every step of the way to support you. Do you have any questions or anything you're concerned about?
Actually, yes. So you're gonna pull something out of my leg. Will that leave like a lot of scarring on my leg then?
Sure, that's a great question. So the surgery that we are using, we it's one of the like lesser invasive surgery. I mean, you will have some scarring where we uh, make the incision at your chest, but the incision on your leg should be pretty small.
Okay, it's going to be a smaller incision. Okay, yeah, I thought it would be a big cut again, and then another one on my chest and one on my leg, and so I just thought I would have, be kind of covered in scars. So, okay, so it's scheduled for like a month away from now, right?
Yes, that's correct. Yeah, you are scheduled July. Let me look here. Look at my schedule. You are scheduled Thursday, July 24th.
Okay, okay, after the 4th of July. Okay, that's good. So, I can just keep the medication that I'm on, right? Or do I need to make any changes before surgery?
So we'll call you 2 weeks before your surgery. We'll have a nurse chat with you about more preparation, things you can eat and can't drink as we get closer to surgery. For now, keep taking all of your medications as prescribed. And once you talk with the nurse, they'll kind of tell you what changes you need to make, if any, to your medication regimen.
I see. Okay. Okay. Well, thank you so much for getting in touch with me and let me know. I really appreciate it. I've been thinking about it and I'll if I have any questions, I'll mark them down and ask those later. Thanks so much. Take care.
Thank you. Have a great day. Bye bye.
Alrighty. Bye.